we are skipping this particular bone, we will cover it in pelvis and abdomen. So, we are stopping, not studying this particular bone like hip bone and the sacrum and pelvis. We are just like restricted this particular bone which is related to the lower extremity. So, your syllabus for the first internal assessment will be upper limb, thorax and lower limb. So, talking about this particular bone, is a long bone, and just like any long bone, it has got three parts: upper end, shaft and lower end. So, these three basic parts is existing in any long bone. This also have that thing page. So, upper end have got features. It has a rounded neck, and then it is connecting with this particular shaft with this particular bridging bone, we call them as neck. So, after this head, circular head, we have this particular neck. Then in this particular neck, which has got like upper end have got features, we call them as trochanter. There are two such projections are there. One is square quadrihedral, which is known as greater, and this one is smaller, lesser, right? Greater and lesser trochanter, which is a kind of like a bony projections that are present in this particular aspect. Now, then we have this particular shaft can be divided into three parts: upper third, middle third and lower third, which is quite long, as you can see. And then it has a lower end which is having a little bit like a dilated part compared to this shaft and upper end, which is having a projections, we call them as condyles. So, we have two such projections are there, we call them as medial condyle and lateral condyles. There are two of them, we are going to identify which one is which one. Before that, we have to identify this anatomical landmark, so that we can identify this particular bone belongs to the which side, right side or left side. So, we have two femur, right side and left side. So, it is a kind of strongest and longest bone, one of the strongest, if it is not the strongest, but definitely it is the longest bone of our body. And it contains like a lot of blood inside, it has bone marrow inside as well. So, if it is having any kind of issue related to the fractures, it leads to the 1 liter of blood loss. So, if you have a shaft fracture of this, we have an internal hemorrhage coming from this particular bone, leads to 1 liter of blood loss internally. So, which is quite a big amount. So, patient goes into shock if you have a fracture in the shaft or related to this particular bone. Now, coming to this particular anatomical side determination. So, we have to identify this basic thing about identifying this bone belonging to the right side or left side. So, upper end and lower end identified by the presence of this particular upper end having this particular head and lower end is having this condyles, dilated projected part. Now, upper end and lower end if you have identified, then we have to identify anterior and posterior. So, anterior and posterior is identified. Posteriorly we have this particular roughness which is present in here in the middle part of the shaft, we call them as Linea Aspera, which is a hallmark for this particular bone, roughness there. Anteriorly it is smooth, it does not have any kind of projections there. So, anteriorly smooth, posteriorly we have this Linea Aspera, and this particular Linea Aspera is present prominently in the middle part of the shaft. Now, the anterior and posterior if you have identified, then we have to identify the medial side and the lateral side. Now, this particular part we call them as greater trochanter. This is projected on the lateral side and this head is projected to the medial side. So, this particular head fits with this particular hip bone, and in the hip bone we have this cavity for this things to fit in, we call them as acetabulum. So, make this joint we call them as hip joint. So, this particular part is projected medially and this one is projected laterally. This lateral part is projected over here, you can feel this particular bony point over here, over this region. This is the greater trochanter if you are feeling here. So, this greater trochanter is that subcutaneous part of the bone which you can feel over the sides of this upper end of the thigh. So, having said that, then we are going to hold that particular bone in anatomical positions. So, upper end, lower end you have identified, anterior and posterior identified by the presence of this Linea Aspera on the back side, front side smoother. Then medial and lateral is identified, the head is projected directed medially and little bit forward, and this trochanter is on the lateral side on the greater trochanter, right. So, if you have this particular bone fitting with this particular descriptions, we have this particular bone hold in like in anatomical position, and this is belonging to the left side because it is fitting all the descriptions, right. So, this is a left femur, you are going to have this particular femur held in like holding the shaft and holding in appropriate hand. Like if it is belonging to the left side, you will be holding it in left hand. If it is belonging to the right side, you will be going to have it in the right side, right. So, once you have identified this, then we are going to identify the anterior posterior other features which is prominent in this particular region. So, in this particular upper end between this particular trochanter, greater trochanter and lesser trochanter, anteriorly we have this particular line which is extending, we call them as intertrochanteric line. Posteriorly between them we have this particular same line between the greater to lesser trochanter, we call them as crest. So, intertrochanteric line present in the anteriorly, posteriorly we call them as intertrochanteric crest, two of this. And intertrochanteric crest in the in this trochanter on the greater trochanter side we have a bulge. This particular bulge which is present in here we call them as tubercle, we call them as quadrate tubercle, right. So, which has given a muscle attachment to a quadratus femoris. Now, these are the features that is present in this upper end. So, upper end have got head, then you have neck, then two trochanter, anteriorly intertrochanteric line, posteriorly intertrochanteric crest with this bulge in this region, we call them as quadrate tubercle. Then coming to this particular shaft, shaft can be divided into upper, middle and lower. Upper and middle we are going to talk about, upper and lower we are going to talk later, because middle part of the shaft on the posterior side have got this prominence. This prominence we call them as linea aspera. Now, this particular linea aspera also known as posterior border. Now, this particular posterior border is flat and wider. It has got two lips or two prominence. One is known as medial lip, other is known as lateral lip, held in anatomical position. So, this linea aspera also known as posterior border of this shaft, we call this linea aspera, which is present in the middle side having two lips, lateral lip and medial lip, based on how this particular anatomical position is held on. This lip we call them as lateral lip of this linea aspera. Medial side we have this thing, we call them as medial lip of the linea aspera. In between we have a strip of this tissue or strip of this particular bone fragment which is existing over here. Now, this particular lips of this linea aspera, as we are seeing, lateral lip above continuous as a roughness, we call them as gluteal tuberosity, and medially the medial lip above continuous with a line, we call them as spiral line, and below this particular linea aspera going down we call them as like medial epicondyle towards this, the medial supracondyle line and lateral supracondyle line. So, towards this condyle as it going down, as it is going down medially and laterally, going down towards the condyle we call them as medial and lateral supra, or above the condyle it is going on, we call them as medial and lateral supracondylar lines. So, these words which are confusing and you have to emphasize whenever you are studying these particular words. So, coming back once again, this point we call them as posterior border, also known as linea aspera. Linea aspera is kind of like a border, but it is a wide border, and this particular wide border have got two lips or two margins. We call them as lips of linea aspera. Now, there are two of them, we call them as or classify them as medial and lateral lips of linea aspera. Between this medial and lateral lips of linea aspera we have some space there, or in between there some areas are there, right. Now, this linea aspera which is prominently present in the middle part of the shaft. Now, this linea aspera as it is going up and going down, it is fanning down or getting fanning up and fanning down. So, as this linea aspera which is narrow over here, as it is moving up it is getting wider, and as it is going down it is also getting wider, right. So, this particular narrow linea aspera which is present in the mid side, above it is continuous with this medial side and the lateral side with two different lines. On the lateral side it is continuous with this roughness, we call them as gluteal tuberosity, and on the medial side it is continuous with another roughness, we call them as spiral line, right. So, two of these particular bony prominence or kind of like lines are there. This one we call them as gluteal tuberosity, which is a roughness. So, which is having a roughness over there. We have this muscle which is known as gluteus maximus. So, gluteus maximus attaches over this particular roughness, that gives this particular roughness into this particular bone, and on the medial border it has this particular line, we call them as spiral line, which is little bit curved, looks like a spiral, but which is having curved there, we call them as spiral line. So, above continuation of the linea aspera, medial lip, lateral lip, that is what you have to remember first. Then the linea aspera going down is curving over here, towards this condyle it is going, and these lines we call them as supracondylar line. Above the condyle it is ending, so we call them as condylar line, which is above this condyles, we call them as supracondylar line. Now there are two of them are there, one is medial and this is lateral. So medial supracondylar line and lateral supracondylar line. Now what happens, this linea aspera above it is holding some space, this region, and below is also holding some space which is narrow in this particular middle part. So lower part of this linea aspera, as it is going down towards this particular supracondylar line, medial and lateral, it finds another particular region. So we call this part which is going down over there, we call them as popliteal fossa, also known as posterior surface. We call them as popliteal fossa. We have a muscle attached to it, we call them as popliteus muscle. So for the name and this particular region, we call them as popliteal fossa, which is lying above this particular condyles. And above here it has this particular triangular area which is there, which call them as posterior surface of the shaft of the femur. Apart from this particular linea aspera, which is known as posterior border, we have two other borders of this particular femur shaft. So this shaft have got two borders as well, we call them as medial border and lateral border. So medial border, lateral border and posterior border. Posterior border in the middle part we call them as linea aspera. In between this particular lateral border, medial border and lateral border, we have a surface, we call them as anterior surface. Between this particular lateral and this particular posterior, we have this particular lateral surface, and in between this particular medial border and the posterior border or linea aspera, we have another surface, we call them as medial surface. So anterior surface, lateral surface, medial surface, and posterior border which is there becomes border at the lower end, which becomes surface here. In this region, posterior border becomes surface in this lower part and the upper part. Clear? So here we usually we find three borders and the three surfaces on the shaft: medial border, lateral border and posterior border. Posterior border in the middle part have got special feature. That middle part of the shaft, we call this posterior border as linea aspera. This linea aspera have got two lips, we call them as medial lip, lateral lip. Medial lip and lateral lip is continuous above and down. As it is going above and going down, it is little bit spreaded, fanned out. Above it is continuous with this lateral lip, continuous with this line, we call them as gluteal tuberosity. On the medial side it is continuous with, we call them as spiral line. Below it is continuous with the medial and lateral supracondylar lines. As it is going down and going up, this linea aspera posteriorly holds another third space, we call them as posterior surface then. That posterior surface in the lower part of it, we call them as popliteal surface. Upper one do not have any special name to it, right? And in between this medial border, lateral border, we have this anterior surface. Between this lateral border and this posterior border, we have this lateral surface, and medial border and this posterior border, we have medial surface, right? So three borders, three surfaces which is existing in this particular shaft of this particular femur. And on this particular borders, there is attachment to the muscles, there is attachment to these particular fascias, we call them as intermuscular septa, lateral intermuscular septa, medial intermuscular septas. They are attached on this particular linea aspera and as well as into this particular borders to give attachment to this and split this particular quadrant into anterior, medial, lateral quadrant, posterior quadrant, and gives attachment to the muscles, right. So this is about the shaft which you are seeing here, upper end shaft, that these particular ends we have to know. Then coming to this lower end have got this particular fanned or projected part which is little bit wider, right. This one we call them as condyles. So two of the condyles are there, one is medial condyle, other is lateral condyle, and if you compare it, medial one is a little bit larger than that of lateral one, and little bit anterior posterior large and transversely also little bit bulged out. The medial condyle, which is having these two condyles, they are continuous anteriorly with each other, does not have any gap between. If you look at the posterior side, we can find a gap between it, right. We have a groove there. So we call them as, between these condyles there is a groove, we call them as intercondylar groove. So anteriorly we do not have any groove, they are continuous. Posteriorly we have a gap there, we call them as intercondylar groove, which is present on the posterior side. Now this anterior end to it, we have this particular articular surface, that means it makes some joint. Lower end, these condyles make some joints, joint with the tibia and joints with this patella which is lying on it. So above we have this part, we call them as the hyaline cartilage which is covering this region. So, this makes this particular upper end having a joint over here. Here is a find we have a joint there for the patella. So, patellofemoral joint is present in here and tibiofemoral joint which is making this particular joint over here, which is a knee joint which you are seeing here present in this region. So, this particular knee joint and the patellar joint, they are present on the anterior surface and making this particular point as covered with cartilage, we call them as hyaline cartilage. Posteriorly, we have the gap which is present. Apart from that, on this medial side we have this particular condyles we have present here, right. The maximum projected part of the condyle we call them as epicondyles. So, if you look at this condyle, at some point it is a little bit more bulged out than that of rest. So, this particular bulged out most position we call them as epicondyles. From there with that line above, that line moves up, we call them as supracondylar line. So, that particular bulged out position or maximum diameter of this particular condyles there, we call them as epicondyles. So, condyles have got bumps, we call them as epicondyles. Now, on this medial side above, other than this particular bumps which we call them as epicondyles, we have additional another bump which is present on this medial supracondylar line. We call them as adductor tubercle. This one which is known as adductor tubercle. So, this adductor tubercle is an important landmark which is present on the medial supracondylar line above this medial epicondyle. This point, this bony point is always present. Now, this medial epicondyle, on top of that this tubercle, adductor tubercle is important. Over here is that here passes that epiphyseal cartilage, that means epiphyseal plate which is there for the bone growth is there. So, this epiphyseal plate runs along this particular vertical line drawn from the adductor tubercle. So, this adductor tubercle have got clinical, forensic, surgical importance there, right. So, this adductor tubercle you have to know about this particular lower end. Now, what you have to know about this particular end? You have to know about the head, you have to know about the neck, you have to know about this particular intertrochanteric line, intertrochanteric crest, you have to know about this particular bony projections, we call them as greater and lesser trochanter. Then we have the shaft. In the shaft on the posterior side you have to must know about the linea aspera, you have to know about the linea aspera, right. Then you have to know about these condyles, medial one and lateral one, and medial and lateral have got posteriorly deficient part, we call them as intercondylar fossa. Then we have to know epicondyle, the most bulged position on the condyles, and on the medial side on top of this particular epicondyle we have this particular bony elevation or bony prominence, we call them as adductor tubercle. So, you have to know these bony landmarks in this particular bone for a must. Apart from that, medial border, lateral border, that we have to know. Clear? And this particular line, linea aspera. Clear? So, upper end have got what features? Head, neck, between two trochanter, line and crest. Line is anteriorly, posteriorly crest. Good, fine. Then we have the shaft. Shaft have got three parts: upper, middle, lower. Middle part have got feature on the posteriorly. Linea aspera. What is that linea aspera? Is a border, posterior border. Now, this posterior border is prominent, and this posterior border have got lips. We call these lips as medial lip, lateral lips. Now, this particular medial lip, lateral lip is continuous above and down. Above it is continuous as laterally gluteal tuberosity, medially below medial and lateral supracondylar line. Now, medial and lateral supracondylar line trace down towards these condyles, and on the condyles there are prominent point, we call them as epicondyles. On the medial side, apart from this particular epicondyles, we have a bony bump which is present on that supracondylar line on top, we call them as adductor tubercle. Adductor tubercle, through that particular adductor tubercle, if you draw a horizontal line that passes through the epiphyseal plate of this femur. Epiphyseal plate is a growth projection of this particular femur. This epiphyseal plate in the lower end, this particular epiphyseal plate is the point where from this particular bone grows, right. So, this is having importance for the osteologic part and forensic part, and as well as other attachment as well for landmark surface anatomy of also this particular landmark is important for us, right. And apart from this particular shaft, we have got like two other borders, we call them as medial border, lateral border. In between them we have surfaces, three of the surfaces there, anterior, medial and posterior, anterior, medial and lateral, they are there. And posterior one is having linea aspera, which is holding a surface only in the upper part and the lower part. Lower part, this particular surface we call them as popliteal surface, by the popliteal muscle attached over there, and that particular area we call them as popliteal fossa. That particular popliteal fossa is a back of knee joint. So, posteriorly if you see this knee joint fold back side, we call them as popliteal fossa region, right. So, this particular popliteal fossa is partly formed by this particular bone above, which is femur, partly by the bone below, which is the tibia. So, tibia and the fibula contributes this particular popliteal fossa. Upper part of the popliteal fossa, lower part of the popliteal fossa is contributed by these two bones. Okay. Good. Now, before we go for muscle attachments, quickly just like a revise, make sure that we understand, then we can identify few of these particular bony landmarks or muscular attachments. We have learned that the general features of this particular bone, and there are still some ligaments and muscles are attached to it, rather many. So, I will emphasize on like the basic which are important for us to identify first. There are several muscles are there, several ligaments are there as well. So, I will be skipping some of them and I will be talking which are relevant for you at the beginning. Later on, as you move through, you will be come across some other muscles. We will talk about those muscles later on and we will figure out those muscles attachment. Now, first about this particular attachment in the upper end, then shaft and the lower end. We will talk about the salient, which is highlighted one, or the important one. Not all I am going to cover, basic ones which are going to talk. Now, if you look at the head, the medial side of the head has a gap. There is a depression. We call them as fovea, F-O-V-E-A, fovea, also known as pit, right. So, fovea or pit of the head. Now, this inside to it, inside of this particular fovea or pit, we have a ligament attached to it. So, we call them as ligament of head of the femur. We call them as ligament of head of the femur. So, this ligament of head of the femur have got embryological and as well as some vascular importance. We will talk about this particular importance of this fovea or ligament of head in hip joint classes or importance to it. Now, this particular ligament that you have to remember. Then coming to this another ligament which is attached to this anterior intertrochanteric line, we have a ligament which is coming from this ilium. It is a part of the bone which is like a femur and ending on the femur. So, we call them as iliofemoral ligament. So, that anterior one on this anterior intertrochanteric line, it gives a ligament attached which we call them as iliofemoral ligament. So, these two ligaments I am just talking out here at this point only. Later on we can build out several ligaments which are attached to it. Now, coming to the muscle attached to these two bony prominence, which is known as greater trochanter and lesser one. So, this greater one which you seeing here, there are two muscles which are attaching out here, prominent out here, I would emphasize memorizing them, is known as gluteus muscles. Now, we have three gluteus muscles are there. We have gluteus maximus, which is the largest of all. Then we have the middle one, we call them as gluteus medius, and then we have a small gluteus, we call them as minimus. We call them as maximus, medius and minimus. So, out of these, the middle brother and the smaller brother, gluteus medius and minimus, they attached on this greater trochanter. So, gluteus medius and gluteus minimus, they are attached on it. Apart from that, we have muscle, we call them as pectineus muscle, gemini muscle, obturator internus muscle. They also attached on this particular like a greater trochanter, but they are smaller muscles. But gluteus medius and gluteus minimus, they are attached on the greater trochanter, that we must know. Clear? So, these two muscles I am emphasizing at this point, gluteus medius and minimus. You remember these two, Later on, if you are done with the memorizing, then you can talk about other muscles which are written on the books like pectineus or some of the muscles like gemini superior, inferior and obturator internus, etc., etc. Clear? So, first on gluteus medius and minimus, they are attached on the greater trochanter. Coming likewise the greater trochanter, the lesser one. Lesser trochanter gives two muscle attached to it. One is attaching on the base, another is on the tip, but we do not categorize it base or tip. In here on this lesser trochanter we gave a muscle attachment, we call them as ilius and psoas. So, together we call them as iliopsoas. So, iliopsoas is a muscle which is attached on this lesser trochanter. So, greater trochanter, gluteus medius and gluteus minimus, and this psoas major and iliacus we call them as iliopsoas. They are attached on this lesser trochanter. Greater trochanter and lesser trochanter, these two four muscles that we must know. Clear? Then on this posterior intertrochanteric crest, that elevation has a bump over there, we call them as quadrate tubercle. That quadrate tubercle gives attached to it muscle we call as quadratus femoris. You can remember quadratus femoris. If not, you remember this tubercle only. If you remember this quadrate tubercle, that is fine, and muscle goes by the name only, right. These two you have to know on this particular prominences. So, gluteus medius minimus and then iliopsoas. Quadrate tubercle, if you remember, fine, not, let go. In this we have a groove there, there is a ligament attached. I am not bringing it right now. As we go through understand this hip joint, we learn about the ligament which is placed on this particular groove on this trochanteric groove or greater trochanteric groove which is present in it. We will talk later on about this. Now, these two gluteus medius and minimus we have talked, right. Now, we are left with other muscle, we call them as gluteus maximus. So, this gluteus maximus attached on the gluteal tuberosity, the big one. The big one is attached on this lateral part under this particular gluteus medius minimus. Then we have this long line which is heading towards this linea aspera. We call this roughness over here, we call them as the gluteal tuberosity. On the gluteal tuberosity we have this gluteus maximus attached to it. So, the gluteus maximus is attached on the gluteal tuberosity, gluteus medius and minimus, they are anterior to posterior, they are attached on this greater trochanter, and on the lesser trochanter we have iliopsoas. Clear? Fine. Then we are moving to the main part where the examiners or where the muscle attachment which is important to us, we call them as linea aspera. So, linea aspera have got two lips, medial lip and lateral lip. So, medial lip gives a muscle attachment, we call them as vastus, and it is medial side we call them as vastus medialis. So, we have a muscle attached to it, we call them as vastus medialis. Then we have a muscle next to it, we have a string like muscle which is attached to it, we call them as adductor muscles. Now, adductor muscle, there are three of them just like gluteus, we call them as adductor longus, adductor brevis and adductor magnus, right. So, we have this particular medial lip of this linea aspera which is this one medial side. So, medial side we have a muscle attached, we call them as we call them as vastus medialis. Next to that we have a tiny attachment of a muscle, above we have this muscle which is known as adductor brevis, below we have longus. Next to that we have adductor magnus which is attached to it. Then we have a muscular partition, then we have this vastus lateralis which is attached to it. So, these 1, 2, 3, 4 muscles which are attached to it in sequence that we have to remember. If you forget about this sequence, remember that this medial lip and the lateral lip. Medial lip gives an attachment to the vastus muscle, a lateral one vastus lateralis. In between them you place these adductor muscles, adductor brevis, brevis means small and longus means long. The brevis is attached on the upper part of the linea aspera, lower part of the linea aspera, under to it we have this longus, and then we have the long muscle next to it, adductor magnus. Magnus is large muscle which has got long shaft attachments, so which goes until this adductor tubercle. Remember the adductor tubercle on the medial side, The adductor magnus is attaching on this particular medial, close to this particular like middle part of this like magnus, middle part of the linea aspera, and anchoring down to this particular adductor tubercle till that part it is attached on it. So, it is have a long attachment on these particular regions. So, these 3-4 muscles which are attached on this particular linea aspera, that we have to understand, that is point of exam concern, because all the vastus muscles are attached to it. Now, vastus, just like gluteus and adductor, they are also 3. They are vastus medialis, vastus lateralis and vastus intermedialis, mean in between them. So, this vastus intermedialis is attached on the anterior surface or anterior 2/3. Below this intertrochanteric line. So, vastus medial and lateral, they are anchored on the linea aspera backside, and this vastus anterior one, also called as intermedialis, they are present on the anterior shaft or anterior part below this line. Clear? So, we are getting 3 sets of muscle, 3 of them. So, gluteus, we are getting this adductor and we are getting this vastus. The vastus are largely present on the front side. We are going to dissect today, we are going to see this vastus muscle. They are lateral, medial, intermedius. We are going to see the front side of the thigh. They are present in the front side of the thigh. They are attached here, but comes over in the anterior side. Overlapping is the vastus intermedialis. So, deep here we have the vastus intermedialis. Then from the lateral side and the medial side, we have this thing wrapped together, like vastus lateralis and the medialis. They are coming and meeting over and making this thing cover. Under to it, we have the vastus intermedialis. Intermedialis is anteriorly placed, and these medial and lateral, they wing around, go over, and then they cover in the anterior part, right. Then we have this adductor muscle, which is present on the back side, but heading towards this lateral side. So, I am sorry, medial side. So, these adductor muscles, they are also 3: long, short and large. So, we call them as brevis, longus and magnus, 3 of them, just like gluteus, large one, max, medius, minimus. So, these 3 sets of muscles, where they are attached, adductor muscles, gluteus muscles and vastus muscle, they are of exam concern. So, whenever you are studying this particular bone, these 3 sets of 3 muscle sets, where they are attached, that you are going to remember, or that what you will be starting with the muscle attachments. Clear? So, when you are studying this particular muscle attachment to it, you will learn that where these gluteus muscles are attached, large one, middle one, small one, where this vastus one, medial, lateral and intermedius is attached, where this adductor muscle, medial, longus, brevis and magnus is attached. This is the way you just go on. It will be easy for you to understand about the muscle attachments. And then iliopsoas on this side, that you have to know. So, this is about the shaft and the upper end, that is the prime muscle that we are focusing out here. There are several other are there, but I am just bypassing them. Clear? So, 3, 3, 3, 9 plus 2 over there, 11 that we are remembering so far. Apart from that, we have some other muscles, yes, just like a dropping at this particular point. Then we are going to talk about 2 things that we have to remember, and easily we can remember out here. So, we have these condyles. On top of the condyles, where we have these epicondyles are there, projected part, we have 2 tiny attachments of the muscles are there. We call them as gastrocnemius. One is known as medial head of the gastrocnemius, other is known as lateral head of the gastrocnemius. Medial head of the gastrocnemius is attached on this side. So, gastrocnemius is basically present on the back side of the leg. So, if you look at this particular leg back side, we have a muscle, we call them as gastrocnemius. It has 2 heads, it coming like V. 2 heads are there, medial head and lateral head. The heads of the gastrocnemius is coming like this on the back side. So, medial head and the lateral head, they are attaching on this particular sides on the supracondylar line, and they are going down and eventually ending up into the leg, back of the leg. So, we call them as medial head of the gastrocnemius, lateral head of the gastrocnemius. They gives an attachment on the lines where the supracondylar line, medial supracondylar line gives attachment to the medial head of the gastrocnemius. Lateral supracondylar line on that part, we call them as lateral head of the gastrocnemius. So, 2 heads and 2 lines, they are giving basically attachment to the gastrocnemius, same muscle, but they have 2 sets of origin. coming from like V or shaped origin. So in between the V we have nothing there. So we have two heads, two fleshes are coming and meeting and making a muscle. Two heads of the gastrocnemius are there, and there are two muscles attached on here, plantaris and popliteus. Popliteus is attached on the popliteal fossa. There is a groove for it. We will talk about later on as we are going to talk about the femur, tibia. We will talk about these two muscles, plantaris and the popliteus. There are two things we will talk later on because they are getting heavier with this content. So 13 muscles we are learning so far. 3, 3, 3, 2 and this one. Two ligaments that we have emphasized on that we are going to talk. Ligament of the head and iliofemoral ligament. Ilium to the femur, iliofemoral to ligament. Right? Okay. Now little bit I am complicating with this particular condyle. So this particular condyle have got two parts of it, medial condyle, lateral condyle. So if you are just like seeing that, and condyles anteriorly they are closed, they are joined with each other. We have the articular surface, that means upper part articulating with the patella, lower part articulating with the tibia. In between them we have a disc, we call them as cusp or meniscus, which is separating between them, they are present between them. If the cusp is or that cartilage is lost, there is an immense friction is there, then we have to do the knee joint replacement surgery. But anyways, so this particular condyles, medial condyle and the lateral condyle, this medial one is larger than the lateral one. So this particular medial one have got few features that you have to know. That medial condyle on the back side, this is the lateral medial part of the medial condyle, this is the lateral part of the medial condyle. This is the lateral condyle. So this lateral condyle, this is the lateral part of the lateral condyle, this is the medial part of the medial condyle. And in between them we have this particular condylar fossa, which is there. And now this particular space can be divided into anterior part and the posterior part. Like this one is posterior part, this one is anterior. That means close to this, like close to this particular tibia, we call them as anterior part. This one is posteriorly placed, we call them as posterior part. Now this posterior part and this anterior part of this particular intercondylar fossa gives two ligament attachment. We call them as cruciate ligament. There are two such ligaments are there. They are known as anterior cruciate ligament and posterior cruciate ligament. They cross each other just like crossing. So C-R-U-C-I-A-T, cruciate. So they are known as anterior cruciate and posterior cruciate. So for that reason we have to know about the condyles, and for the condyles we have to know which is the medial side and the lateral side. So if you hold that in anatomical position, then we can identify one condyle at a time. Medial condyle, then medial condyle, this is the lateral side, medial side, and this is the lateral side. And this one, this is the lateral condyle, this is the further lateral side, and this one is medial side. On this lateral condyle there is a groove there. You see that on the outer side, I am escaping this groove because when you are going to talk about this upper end of the tibia, we will talk about some muscle attached to it and some other ligaments which are relevant to it. We will be adding up to this particular thing when you go to talk about this particular joint class in tomorrow about knee joint. And we are going to go to talk about this particular femur and as well as the tibia and the tibial part together. We will talk about the lower further muscle attachments. So till now we are just holding this particular 9, 2 and 2, 13 muscles, right. So these muscles attached, you have to just remember for the day. Then we will just add up few more, not too many, then 2 more, 15 muscles we will talk about. Then we have plenty of them, we will be escaping them later on. If you have time, we will talk about it, right. So see this particular like bones, look for this muscle attachment. If you have any confusions,